I mean, it's tough. It's tough on everybody. I know every time I think of it, I have to think about, I've got parents too. My parents are both 80 plus. We look after them. And it's hard not to think of them when you see what's happening around.
I was fearful of getting to a stage of someone being critical. I was very scared of that one because I had seen enough of situations overseas. I kept thinking of my wife. If we have to take her in for oxygen support or for ventilator, we will part at the gate. And that parting will be very, very hard. Nobody else will go in with her. And she's lucky, we'll get a call. She's better now, you can come collect your relatives. Otherwise, you get the worst call to say that your relative has passed away. You would never get over. I would never get over the guilt. I would always feel I failed her.
So we're in Command 1 at the moment, heading across to Bunindao for a severe suspected COVID case, an 84-year-old female. We're heading across with the RFMF AMBO, which is call sign Saivotolu. We've just heard on the radio that 2 other police ambulances have been dispatched to another severe case, so it's a busy night again here at the FEMAT Prehospital COVID operations. We've had to make some tough calls in the past few days as the number of cases have increased. Our doctor on the team, Dr. Naitini, if he had it his way, he'd try and save every single life. Unfortunately, we don't have that luxury. We're okay with an oxygen. We have enough oxygen there to last us for at least 2 hours. So the trip from Bunindao across the Suva is approximately about 40 minutes, so more than enough. Also to cater for any hold-ups if anything should happen along the way. We've also got spare cylinders here with us as well, and other additional gear that if in case it's needed for the patients. Control, this is Command 1 over. Control, Command 1 and Saivotolu clearing from FEMAT isolation at this time, over.
Command 1, this is Control,
so we've just arrived at the FEMAT hospital here at the Vodafone Arena in Laudala Bay. The team from Saivotolu have just safely delivered their patient, who we brought across from Bunindao. She's still alive and well. So they've just transferred her across to one of the isolation tents for the treatment by the Ministry of Health team here at FEMAT.
See, the world that we see, the one that's going to occupy all these beds, This is one world that we live in. And there are some people who live in a very comfortable world. They go through their mundane activities every day, and they don't see this. And one thing that I really want to remind those people is that, whatever you do out in that world, in that less painful world, in that world where you are free to move around, where whatever you do there has an impact of what happens here.
This virus, somebody said to me, it's just like a flu. Yes, just like a flu. But if you are in the high risk category, be careful. So if you are in a high risk category, and every one of us has relatives who are in the high risk category, either because of their age or because of some pre-existing conditions. So we must get vaccinated. I have a lot of forums that I join, and each one of those I'm fighting with the people who are very negative. I don't know, if I had succumbed to those negativities, I don't know whether I would have survived. I'm very positive that vaccination is the only way for us.